Okay, ladies, today our class is about immediately after birth. Now, once again, these are kind of a general rule of what happens immediately after birth. Everybody's experience is different, everybody's delivery is different. So they may need to pay more attention to you than generally what is outlined here. They may need to pay more attention to baby than what is generally outlined here. But this gives you a really good snapshot of what's going to happen and what you can expect for the atmosphere to be like right after delivery. Okay? Did it go to the next one?
I think so, yes.
Okay. So your healthcare provider will determine whether you need repair of any tears in your vaginal region. Now, why might you get some tears in your vaginal region?
You push your baby out?
Because baby comes out and the vaginal tissues are stretching and stretching and stretching, right? So sometimes just the baby rubbing against your vaginal region can cause a little what they call skid mark. Sometimes that skid mark is so deep that it's more of a cut, but it comes from a skid mark. They'll probably need to suture that up too if it keeps bleeding. Things like that. Or it may actually split a little bit. And so some sutures need to be put in place for those things to be repaired. So you can be repaired very well and you can go on and live a wonderful life after that. If you don't have an epidural, which is that anesthesia that they put in your back and you're numb from the waist down, then you'll receive an injection of local anesthetic in the area to be stitched. So they'll just take a syringe and they'll put a little bit of anesthetic right there where you need to be stitched. And it does pinch a little bit, but it feels way better than them sticking a needle in you several times to get that stitch going, okay? So they're gonna numb that up for you, and then the medical staff will clean you up. Look, these technicians are fabulous. This is what they do all day long. They come in, they pour all this stuff on you, they clean you up, and it feels amazing. Just relax during this time. Don't worry that somebody is down at your private area that you don't know. They are professional, they are wonderful, and they're there to take good care of you. So just relax during that time. Take some deep breaths. Maybe you'll be holding baby, maybe not, but just enjoy that time. Somebody's taking care of you. All right? They might put an ice pack in your vaginal area for 20 minutes every 2 to 4 hours to reduce swelling. Now that doesn't sound like it's going to feel very good, but ladies, believe me, you're going to want it. Yes, that's going to be the best 20 minutes. As soon as you put that up there, you're like, yes, thank you so much. It's going to help you tremendously. When you feel like an hour later, that area warming up again because of the blood flow and there's a lot going on, that healing process, ask for more ice pack and they'll bring that to you. It's going to be amazing. If no epidural, then you can get up, look at that, within an hour to go to the restroom. Now, they are going to emphasize going to the restroom after you have a baby. It's a big deal. All right, so as much as you can, you need to try to urinate, and as soon as you can, you need to try to have a bowel movement. Okay, so that they're gonna go, oh wow, she's doing great. She's already had a bowel movement. She's already urinating well, and all of those things are signs of you being healthy and that repair process happening well. Okay, how you may feel. You might feel elated, exhausted, emotionally drained, or all of these feelings at once. That's normal. What's going on? Baby's out, and as soon as baby comes out, placenta comes out, all of your hormones start to shift and change. And it's time for something new. That new thing is, okay, now we repair, we don't have baby anymore, we're trying to get back down to normal, and we're probably going to breastfeed. So a lot of that tissue up there is changing, all of your hormones are shifting. So you may have lots of shifts in the way you feel, and you may feel all the feelings all at one time, and that is okay. Rest, breathe, and console yourself that it's normal, all right? All mamas go through it. You're going to have vaginal bleeding like a heavy period. A couple of times mine was more than that. Like I couldn't take a shower without it just pouring down my legs. So it can be a whole lot. don't be super concerned unless you start to see some clotting coming out. Then just ring that bell, tell the nurse to come take a look, make sure everything is okay. They're going to be listening to your belly a lot. They're going to be probably pressing on it a little bit to make sure that everything is okay in there. They're looking for blood clots and things like that. But you should be bleeding a lot. All right? A lot just happened. Everything came out. That was in there for such a long time. So it's all right to bleed a lot. You may have afterbirth pains as the uterus starts to contract to its pre-pregnancy size. So about how big is your uterus at the beginning, before you're pregnant?
Like starts with apple.
Yeah, it's like super small, right? And then it has to grow big, big, big for baby to fit in there. So it grows, when they measure your belly, that's how high your uterus is growing. That's that fundal measurement that they do when you go in and they're checking you at the doctor's office. So it gets really big. About how long does it take for it to go back down?
Depends, doesn't it? A few days.
Oh no, it should be about 6 weeks. So that's why they tell you, hey, come back and see me in 6 weeks. That's your regular postpartum checkup, right? They want to go down. Now, just because your uterus goes down in 6 weeks doesn't necessarily mean the rest of your body is going to be back down to normal in 6 weeks. Sometimes it is if you're really young and you're really lean and everybody's different. But if it takes 9 months for you to grow this baby and you've got some extra things in extra pockets in extra places, give yourself at least 9 months to come back down to anywhere close and put your jeans on like you did before, all right? If you can do it before then, fine. But take a breather, enjoy your baby. Don't worry about that. But about 6 weeks is how long it takes for that to come back down. And those contractions that you're going to be feeling afterwards, those feel like labor pain, but that's what's helping that uterus contract back down. So to mitigate the pain that might cause, you could use a warm pack on your back or belly, and that may help. Then you can also ask your doctor for pain relief, of course.
When you breastfeed, why does it hurt more?
Because of the hormone release, as the baby is suckling, it causes your uterus to contract harder, which is great because it's helping the healing process and for everything to return back down to normal.
Don't if you breastfeed, it goes down a lot quicker than 6 weeks.
It depends. It really depends on the person because, a lot of people say, well, if you breastfeed, then you're going to be burning so many calories that you're going to lose all that weight much faster. Well, not all the way. All the time is super true because it depends on how young or how not young you are when you have your baby. When you're nursing your baby, I nursed all of my babies, but it was hard for me to lose weight after my third compared to my first. Okay, so it just depends on the person. Okay, how your baby looks when they're born. Ooh, I see you crinkling your nose up. Why are you doing that? This is a beautiful, healthy baby.
Don't say cheesy, please.
It looks cheesy.
Well, exactly. It is cheesy. And it's very important for that baby to be cheesy when they're inside your uterus. It helps protect their skin from the constant exposure of the amniotic fluid. Okay, so your baby's skin may look dark red to purple at first. As the baby breathes air, skin changes to red, then fades to pink. It will have a thick white substance on it called vernix. Yes, like I just said, that helps protect baby from the constant exposure to amniotic fluid while in utero. Because babies' heads are made for bones to overlap to fit through the pelvis, some vaginally delivered newborns will have cone-shaped heads. The bones will settle and the cone shape will go away. So, what is that called?
The cone shape?
No. What is that called on the baby's head?
The soft spot.
The soft spot. So, it is an area where the cartilage has not closed in yet, right? And it's, thank you, Lord, that He has made it like that because that helps the baby's head shape to the birth canal. as the baby's coming down in the birth canal, the baby's head just is kind of squished a little bit here and there, and so when they're born, it may look a little bit weird.
Yeah.
I've seen cone shaped, and I've seen some other weird shapes. It's just however they were sitting in that birth canal, they could have been a little bit cockeyed, and then as they came down, they turned straight on. But if they were cockeyed for a long time, it might be a little bit crooked on top. The beautiful thing about it is it takes like 24 hours, 36 hours for that to settle down, okay? So, but it is for a purpose, and it's for a purpose that is in our benefit, babies as well, okay? So it is okay. That cone shape will go away. All right, baby's care. The nurses will take your baby to the warmer in the room to finish drying off. They will measure, weigh, and give baby a quick assessment to make sure they are healthy. What is that called when they're first born and there's a test they give them and they give them so many points for this and so many points for that?
Is it like when they do like the hearing?
Not the hearing test. This is
Skin
reflexes, skin color,
Breathing.
respirations. Yes.
Apgar or something.
APGAR, that's right. That's the test that they do on them. And so they will give them so many points for different things that they're grading them on, like respirations, their skin color, their reflexes, things like that. And so if they are lacking in their APGAR, they're going to really be paying more attention to baby. They're going to be trying to pull them up in different areas. If their skin's not well, they're probably struggling with their respirations. They're probably going to give baby a little oxygen, things like that. Help that baby kind of wake up and move around if their reflexes are not very good. So they may spend a little time with the baby, but other than that, you want that APGAR score to be up and good. Hopefully, if you ask, hey, what's the baby's APGAR? They're going to tell you. They're going to know exactly what you're talking about. And if they're talking about it, you'll know what they're talking about too. So you will continue skin to skin with your baby. What's skin to skin?
Like you hold them with your breast.
Yes. So baby just has diaper on, and you pull down your gown and put baby underneath your gown, put a blanket over. Skin to skin is exactly what it is. So baby skin on your skin. It's very comforting to the baby, and it really helps development and closeness. It helps you get close to baby and baby get close to you. Okay, within the first hour, some babies are ready to feed, or they will just be sleepy and want to sleep. Baby's tummy is only as big as a walnut, so they don't need to eat much. But if baby's hungry, feed baby, all right? After about 8 hours with normal body temperature, your baby goes to the nursery to get a bath. This is usually done right after a feeding, since most babies sleep after being bathed. Nurses will wash, dry, and dress them. Some hospitals will bathe the baby in your room if requested. I want somebody to request that, because I didn't know that. I didn't request that. I didn't know I could request
They don't
that.
have a nursery at my hospital, so they'll probably bathe her in your room.
That would be so
Yeah, that's
awesome.
what they do with John Seeley.
Yeah.
That would be so awesome. Okay, after 24 hours, they draw the blood from the baby's heel. So they do like a little heel prick, and then they take a little vial and they press against that opening and they pull some blood. And what they're looking for is, they're looking for jaundice. So jaundice is where the baby's skin is yellow, or maybe the whites of their eyes are yellow, because it's those red blood cells, those dead red blood cells that are built up in their system, and they need to be filtered out. So baby needs to eat a lot if baby has jaundice, and they need exposure to the sun. Okay, not direct exposure, but indirect exposure. And if that bilirubin is what they're counting, if that bilirubin in the blood is too high, then they may want to put baby under the lights. They have special lights in a hospital to help mitigate that and bring that number down. All right, the nursery. Mom will keep baby in room as much as possible to learn to read hunger cues and feed baby. This is huge, but it is not solidified during the first couple days baby is born. But you learn to read each other. You learn to know each other. through that time, and it's super important for baby to be with you. The nursery can also be used if moms need to rest from a long delivery. I had a lot of children at home, and I knew they would be at home waiting for me. So when I needed to rest, I called the nursery and said, please come get my baby so I can rest. And they did, and I got probably 30 or 45 minutes of rest at that time before something else needed to be done. But if you need that time, take that time. All right, going home. If you have a vaginal birth, you can go home between 1 and 1.5 days. If you have a C-section birth, you'll stay a little bit longer. It takes a little bit longer for you to get up out of the bed and get moving, and they want to make sure your sutures are all good. So 2.5 to 3 days on that. And then if you have a premature birth, less than 36 weeks, mom can go home within 2 days as long as it was vaginal. But baby may stay in hospital depending on how early baby was born. It just depends on the situation of the baby, how baby is doing. All right, so we're ready for question and answer time?
Yes.
That was kind of a short segment, so take a big breath. Here we go. So name something that happens right after baby is born. Just something.
Skin to skin?
Say it again.
Skin to skin?
Yes, you can do that.
They take care of your vaginal area.
Yes.
Apgar.
Okay. I'm just trying to get your brains to work. All these answers are good answers.
My brain is so dead for the day. My brain is so dead. Okay, so yeah, they take care of that. They give your baby well, that's not directly after birth. I can't think of anything else.
Remember that part where somebody you don't know is going to be down there doing something to you?
Oh, they so your thing.
Oh,
Yeah.
they make sure it's okay down there.
Yeah.
Yeah, but then they come in and they clean you, right?
Oh.
They come in and they clean you all up and make sure you're okay. It gets a little messy down there. So they come in and you just rest and they will clean you. It is truly, truly amazing. All right, if you didn't have an epidural, what will a doctor do before stitching any tears?
Putting anesthetic, like a shot down there.
Yeah. I'll give you a shot. Oh, I do have some Smarties, so just say if you want Smarties instead of a Kit Kat. I don't know how anybody wouldn't want a Kit Kat. All right. How soon can you get up and walk after a baby is delivered if you do not have an epidural?
1
1
hour.
hour.
Good. Which one do you want?
This one is fine.
Which one do you want?
Kit Kat. Thank you.
Okay. What about if you did have an epidural?
2 hours? 2 to 3 hours?
It's gonna be when you can feel your legs.
Oh,
It's
yeah.
gonna be kind of just dependent on you, but it's gonna be maybe a little bit longer.
Mine was way quicker than that. Maybe
I'm sorry?
when I gave birth and I had epidural, like I was walking a lot.
I think it's how much
Epidural
of it-
I got?
Yeah.
I think so too. And how soon they stop really releasing it into your back. Mhm. Okay, so what are some feelings you might have after birth?
Excitement,
Yes.
exhaustion,
Yes.
overwhelmed. I don't know.
Well, are you just gonna get all the treats here? You don't know how
I'm
you
sorry,
might
I'm
feel?
asking questions.
Everything?
All the feelings?
All the feelings.
Yes, you're gonna be feeling all the feelings.
That's pretty emotional.
Very emotional. Is that okay?
Mhm.
Should you be super concerned if you're feeling emotional after you have just had a baby?
No, I wouldn't.
So what are some things that you can do to reassure yourself that this is okay?
Talking to someone.
You
Like,
can
I'm
talk to
not-
someone, absolutely.
Breathing techniques.
Yes. Taking deep breaths in. How about just reminding yourself?
Yeah.
Talk to yourself. There is no one in charge of the words in your brain except you. You are in charge of your thoughts. And if a thought comes and it's not productive, push it away. Nope, not gonna think that. You can do that. You can be in charge of those words in your mind. So make sure you're constantly speaking, no, 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 no. This is not weird, it's normal. It's normal for women to be hormonal after they have a baby. Okay, so what is vernix?
That white, gross-looking stuff that's on the baby after you give birth.
The cheesy stuff.
I'm never
Yep.
gonna eat cheese again because of you.
Aww.
Gross.
What is the spot called on the baby's head that helps it to fit through the birth canal?
The soft spot.
The soft spot. Good job.
That was a sweet spot.
What is a very important bonding exercise you can do with baby?
Skin to skin.
Everybody gets it. Awesome. And I'm going to run out of candies. Everybody answered that, so we'll skip that one. What are doctors checking for when they take baby's blood 24 hours after birth?
Jaundice.
And chronic heart disease.
Good job. I remembered when I just read that, I was like, I didn't say the other thing because I just talked so much about jaundice. But you read it and you remembered it. Good job.
Was that in the PowerPoint? The chronic heart
It
disease?
was. It was. Okay, so how long is hospital stay for a vaginal delivery?
1.5 days.
Yes, 1 to 1.5 days. And what about C-section?
It depends on
2.5 to 3 days.
It's 3 days.
What if you don't have a bowel movement or like pee? Right after, do they make you stay longer or do they just like call you when you're at home?
That's
like,
going to
"Hey,
be
you do
at
it?"
the doctor's discretion, I'm sure. But don't be that girl.
That doesn't.
Don't be that
Poop.
girl. You gotta poop. And it might be a little bit scary because there's other things going down there, you know, you're trying to heal, maybe you have sutures, maybe things like that, but you gotta poop.
What if you go during birth? Does that count? Like it has to
Well,
count. If
let
we're-
me say, it's okay if you go during birth. It's normal, most women do it. But it doesn't count for afterwards.
Oh,
Yeah.
true, I guess. I would just think that. No, it's working.
They're still gonna be watching you.
Oh.